I definitely am in the room because I'm a part of a couple of priority groups. I'm a woman. I am a Black woman. I am a Southern woman. Okay. And so I am a Southern person. And so if you run the stats, you can see each individual ones from Black people, women to Southern people. When it comes to diabetes, these are all groups that rank higher. They're priority groups. Okay. So I can speak from a place of being a part of more than one priority group. I can tell you about my auntie. I can tell you about my mama's care. I can tell you about a lot of things because these are real people for me. And so anyways, anywho, I get tapped for that. But then I also get tapped for prevention and management and stuff like that. And the thing that I did not think was going to happen, I thought I was going to show up and I was just going to be talking about prevention and management and some clinical best practices, which I do. But one of the big issues that I find out that a lot of people are struggling with is how to get their patients engaged. How to get their patients engaged, especially during this COVID season, where people are so used to going virtual and now people are wanting them to come back into the clinic. How do we get them to come back into the clinic? How do we because some things you can't do virtually. You can't take no blood pressure over the phone. You can't do that over video. Like that's something that you would want somebody to do in the clinic. You want to be able to get those labs and things like that. And people were having a hard time getting people to come back in. But then once they came back in, getting them to re-engage with the clinic. And I was just like, wow, I just guess I didn't ever really think about that like that. I was like, I guess I did not, you know what I'm saying? Yes, getting them to take part in their own care and so I was like, okay, mind flip, we can talk all day long about prevention programs. We can talk all day about algorithms. We can talk all day about treatment. But if you don't have your patients in the clinic, who you treating? You see what I'm saying? And so I found myself really talking a lot about how to get patients back into the clinic, how to engage your patients that are there, how to keep them motivated. And they're just, I think as clinicians, we can think so scientific, but we forget that these are just people. They're just like us. We lose interest too. We lose interest as well. How to keep people, especially when you're dealing with somebody who has chronic disease and especially someone who has diabetes, right? They're in it for the long haul. So you can only expect that eventually people are going to get tired. Like, think about it. Think about your patients with diabetes. Like they're having to take their blood sugar every day. They got to take these pills. All right. They got to go into the office every 3 months. And that's just one diagnosis. We're not thinking about all the comorbidities that can come with this. We're not thinking about all of the specialists that they may be referred to. And we're not thinking about the co-pays and the access to all of this, right? We're not thinking about, yes, you just referred that person to an endocrinologist, but because endocrinologists, there's not a lot of them. Nowhere, actually. They're probably the specialty that probably has the least amount of specialists. It's so many people with diabetes and this many endocrinologists. Not to mention that endocrinologists just don't do diabetes. That's actually low-level fruit for them. Right? You have many of them that do, tumors and they do thyroid issues. Even thyroid is to some degree, low level for them. They do infertility. They do all of that. All our glands, they take care of that. And then, so no wonder so many of them only have so many openings for diabetes prevention and management. All the more reason why we need to know how to do that in primary care, at least to a point where we can get them into the endocrinologist, right?